Hi all, I am Dr. Karthik Pichka, Senior Resident, Department General Medicine. As we all know, diabetes mellitus is one of the dangerous non-communicable disease which is highly prevalent in Indian scenario and also the world population. So one more thing we will all know, most of us know, Metformin, the drug Metformin. We give it for diabetes mellitus, usual oral anti-diabetic agent for type 2 diabetes mellitus. So we will see about Metformin for diabetes prevention. Metformin for diabetes prevention. So what is the ADA diagnostic criteria for diabetes mellitus? They say the normal fasting postprandial, that is 2 hours, 75 gram, OGTT and HbA1c. These three are taken into consideration. The normal HbA1c less than 5.7, normal fasting glucose less than 100, the normal 2 hour 75 gram OGTT less than 140. So one more, I want to introduce a term pre-diabetes, that is the impaired fasting glucose and impaired 2 hours 75 gram OGTT. So when the fasting values are between 100 and 125, we call it impaired fasting glucose or pre-diabetes. When the value is between 140 and 199, that is impaired. Well, the HbA1c between 5.7 and 6.4 is pre-diabetic state. What about diabetes? Diabetes, when the fasting values are between less than 126, 125 is impaired everything. So if it is more than 126, the individual is having diabetes mellitus. And again, the 2 hour 75 gram OGTT, if it is more than 200, that is diabetes mellitus. HbA1c more than 6.5, it is diabetes mellitus. So all this is one consideration. Number 2, what about random blood sugar? The patients with classic hyperglycemic symptoms with a random glucose of more than 200 accounts to diabetes mellitus. So when are we going to give metformin for these individuals? Metformin is more effective if the fasting plasma glucose is more than 110 milligram per deciliter, and of course the age is less than 60 and BMI more than 35 kilogram per meter square. We will have to support this metformin drug with proper lifestyle modification. So what are the risk factors for development of pre-diabetes and type 2 diabetes mellitus? For these individuals, of course, we give metformin. So risk factors: family history of diabetes, habitual physical inactivity. Nowadays there is sedentary lifestyle, so these individuals are at high risk for diabetes mellitus. Afro-Americans, Native Americans, Asian Americans, these are all. So previous impaired fasting glucose or impaired glucose tolerance are high risk of development of diabetes. History of GDM, hypertension, LDL cholesterol less than 35, and individuals with polycystic ovarian disease, and of course history of vascular diseases, there are high risk of development of diabetes mellitus. So what are the modifiable risk factors that we know? Of course, obesity, typical body fat distribution, increase in waist circumference, physical inactivity. We can advise them for increase in activity of daily life, and elevated fasting and 2 hour glucose level, dyslipidemias, hypertension, smoking, alcoholism. So for all these individuals, what did ADA tell? ADA gives metformin for those individuals who have both impaired fasting glucose and also impaired glucose tolerance. And we have discussed some risk factors earlier. So if the individual's age is less than 60, if the individual's BMI is more than 35, if there is family history of diabetes, triglycerides increased, reduced, HDL and HbA1c more than 6, all are considered. So how are you gonna prevent diabetes mellitus? What are the recommendations? Regular physical activity. By that I mean we achieve a weight loss of at least 7%. So moderate exercise 150 minutes per week. So what are the interventions to reduce obesity? Waist circumference we have to reduce, and taking proper measures we reduce waist circumference, body weight, body mass index, and we have to identify women with gestational diabetes mellitus. Of course, finally, drugs like metformin and a lot we can advise to the individuals. Thank you.